You should never be pressured to do something that you don't want to do, but you should understand your options. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 287, and today I want to talk to you guys about being pressured into do a hearing treatment that you are not yet ready to do. But before I get into it, do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to this channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. All right, so here's the deal. As an audiologist, I feel like it is my responsibility to make sure that my patients are educated on what their hearing loss treatment options are. In fact, my process inside of the clinic that I mandate for not just myself, but for my other audiologists is to educate first and treat second. So when I came across a particular post in a hearing loss forum, I just couldn't help but record a video about it with my perspective. Let me just go ahead and read it to you. So here's the post. Do audiologists make a lot of money from getting patients to get cochlear implants? I had an audiologist appointment yesterday, and she must have pressured me for at least 45 minutes on getting cochlear implants before she even did a hearing test. I did tell the audiologist that I had a profound hearing loss and communicated to the front desk receptionist that I was not interested in cochlear implants before the appointment. The experience was very upsetting. I made an appointment for a hearing evaluation in order to get new hearing aids and was told I would be charged $140 for that. Instead, I was charged for pure tone audiometry, clean and check of hearing aids, retube of ear molds, and reprogramming of my current hearing aids. I've been deaf for over 40 years and the profession has changed for the worst. Audiologists now look at me with dollar signs in their eyes. As usual, I can look at this from two different lenses. I can look at it from the lens of the audiologist and I can look at it from the lens of the patient. But I do want to address several aspects of this post. First and foremost, if a patient feels this way, usually the audiologist did not communicate effectively with the individual. Now, I'll make a reasonable assumption that the audiologist's heart was in the right place. They probably had someone that they were even struggling to communicate with because this individual has been deaf for 40 years based on her own admission, but they probably went a little too far in trying to convince this individual to get cochlear implants, especially if that information had made it to the audiologist when this individual scheduled with the front desk reception. That being said, not all of the information goes from a receptionist to the audiologist in all cases. A lot of times it's put in as maybe a quick note inside of the chart. Sometimes it's not annotated at all, at which point it would be really more of the fault of the receptionist. The other thing that I'd like to point out is that this individual felt like the incentive for the audiologist was so they could get paid more money, and I'll just go ahead and throw this out there right now. Audiologists make substantially more money on selling you hearing aids than what they do for recommending cochlear implants. You have to remember, cochlear implants is pretty much all insurance-based, which means that hearing care professionals hardly get any type of compensation from the insurance company to provide you with those devices. On the other hand, unless hearing aids are covered inside of that same insurance where they would make very little money on giving you a recommendation and treatment with those hearing aids, they make more money on the hearing aids if they are private pay. So I just don't believe that this audiologist really was trying to sway this individual into getting cochlear implants because they would make more money. Honestly, they would probably make substantially less money if they had convinced this individual successfully to go the cochlear implant route. Now, if I go ahead and put myself into the shoes of the audiologist, and I had a patient come in just like this who was basically like, you know what? I've been deaf for 40 years, but I still don't want to get cochlear implants. I'm happy to get a new pair of hearing aids. I would say, that's great. I can definitely help you with that. Now, are you making that statement because you are just not interested at all in cochlear implants, or you've done your research and you really know what it entails? If they basically say that, like, listen, I've done a lot of research, I just don't feel like it's right for me, then I would say, great, let's move on and just focus 100% on hearing aids and just make sure that you understand the limitations of going the hearing aid route again. However, if they told me that they're just like, you know, I'm just not interested and I don't really have any reason why I'm not interested, I'm just not interested, I would be like, great, let me just make sure that you understand what cochlear implants are. And I wouldn't spend a lot of time. I'm talking maybe 2 minutes on this topic just to make sure that they really understood what what the intent really of cochlear implants are. And if they're like, great, thank you for sharing that information, I would be like, cool, if you're still not interested in going any further in the educational side of cochlear implants, I would go right back to what this individual had come in for, which is an updated hearing test and new hearing aids. Now, I can't put all of this on the audiologist. Some of this has to go onto the patient as well, and I know you guys might hit me for that in the comment section. It is what it is, but everybody with hearing loss also has to be an advocate for themselves. So you have to pay attention to how you're communicating with the hearing care professional. If they start going down a road, especially for 45 minutes on a topic that you do not want to go down that road with, you have to make sure that you say, hold on here. Listen, I appreciate that you're trying to educate me on cochlear implants. Listen, I get it. With my level of hearing loss, I can understand why you would want to go down that route, but I am not interested in cochlear implants. I've been told about it before. I've done my own research. I know what it entails, but really I'm here for this particular reason. If you can't help me with that, then maybe I need to go somewhere else. But if you can help me with that, I would really like to focus on that and put the cochlear implant thing to bed. With that said, I always think that everybody should be curious about alternative options to treat their hearing loss and things that are potentially new. This individual may have learned something new from this audiologist that may have much more experience with cochlear implants than anyone has ever had that is communicated to this patient before. At the end of the day, we are in a communication business, and the job of an audiologist is to first and foremost communicate effectively with the patient who's in front of them. That means listening to what the patient wants you to talk about. If they don't want you to talk about a certain thing, then you don't talk about that thing and you start veering your conversation onto things that the patient is there for. At the end of the day, if you're the individual with hearing loss going in to see your audiologist, you should never feel pressured into doing anything. You should feel like they're just trying to educate you and then give you a solid recommendation on what they think that you should do, but there should never only be one recommendation. There might be a strong recommendation for one particular thing, but you get to decide what is right for you. If not going the cochlear implant route is the route that you want to go and you want to go hearing aids instead, you should be afforded the option to be able to do that. But let me know what you think. Do you think that all of the blame is on the audiologist for this one, or do you think that all or some of the blame is actually on the patient for this one? Let me know what you think down in the comment section.